Hello, everyone. This presentation will review revisiting public health and social work. We talked a little bit about this, or we introduced you, or I introduced you to this earlier on in the course, really understanding the role of social work in public health. But now we're going to revisit some of those concepts as somewhat of an overview, but to reinforce concepts learned thus far in the course. The objective of this PowerPoint presentation would be to review core functions of public health, as we talked about earlier in the course, identify shared values and theories of public health and social work, examine the role of social justice in public health, and discuss the intersection between public health and social work. We also highlight the role and function of public health social work as it relates to public health and present a 2017 population health initiative as a good example of public health through use of social work practice skills. So again, if you remember at the start of the course, we talked about the core functions of public health, which is assessment, policy development, assurance, and interdisciplinary collaborations. And when we're thinking about interdisciplinary collaborations, we're talking about our work across disciplines with nurses, physicians, managers, community members that have various professional roles, maybe advocate, a policy analyst, epidemiologist, for example, community health workers, another good example of our interdisciplinary work. And so social work and public health values. Quality healthcare is something that is shared by both social work and public health. And it's the belief that everyone needs to have access to quality healthcare services. Family and individual income. Everyone should have a livable wage and access to education opportunities to increase income. And we know income plays a big role when we're talking about social determinants of health, not just income, but housing, education, all those social factors improve health outcomes. So understanding that someone's income and having access to a decent income to improve health outcomes, particularly, is also a shared value of social work. The social work, the grand challenges of social work, identified earlier in this course in the video, talks about how um, um, reducing the income gap is key. And also, some of our social work grand challenges discussed early in the course also talks about equitable, reducing the health gap and equitable access to healthcare services being a specific grand challenge of social work. Environmental safety, everyone should have access to sanitary water, air, and live in safe, violent-free neighborhood with quality resources. And this is making sure that our patients or clients that we work with do not live in food deserts or live in areas that are overran with fast food places, which we know are not is not healthy in terms of diet. We want to make sure that our environments are healthy and have quality resources such as gyms and parks, things that increase or motivates physical activity. We also talked earlier in the course about how policy and leadership at the government and state government level had impacted environmental hazard and conditions, particularly related to the Flint water crisis. We also talked about environmental safety as it relates to COVID-19 specifically in this course this semester, how we've been handling the public health pandemic, wearing masks, are following CDC guidelines. All those things are part of environmental safety. How are we keeping the public safe through spread of virus as well? And we've also talked about discussions related to lead, which is an environmental safety hazard, and particularly with buildings that are older and constructed with lead paint. And we also talked about other type of issues that you don't traditionally look at as a public health, but is considered a public health concern, such as child maltreatment and so forth. So we think about environmental safety. We're looking at water, air, but we're also quality of life and how we're living in a safe, violent-free atmosphere. And so that's another shared value between public health and social work. And again, equitable access, and we've talked about this, and we think about health disparities when we think about improving access through insurance coverage or payers. We want to make sure everyone has quality health care services that improves health outcomes for all. And so again, access and cost plays a role directly in whether somebody can access services. But we also know that the way health systems are set up, there are some rural areas where people don't have access, or they don't have enough healthcare services in a given area where people can actually access them. And when you're talking about people who are poor and impoverished, they may not have the resources to travel um, um, to have access to healthcare providers. And so then when we think about those shared values between social work and public health, we can then have a better idea of what realm or what areas these values fall. So when you're thinking about quality of healthcare, that's a social justice issue. Family individual income is an economic justice issue. Environmental safety is an environmental justice issue, and we think about how equitable access. There's strong alignment there with health disparities related to outcomes that poor health outcomes related to disparities. And so, what are some of the theoretical approaches that we think about um, when we're talking about public health? And some of you identified this in your papers when you're thinking about theoretical approaches to address health disparities. Ecological approach and the person and environment approach. The ecological approach focuses on population level and individual level determinants of health. And that link there is an introduction to the ecological model in public health. The person and environment. It's important to understanding an individual and individual behavior in the light of the environmental context in which that person lives and acts. And so, through your work here in the program, think about these theoretical approaches and how it applies not just to public health, but your different courses and your work with clients. Ecological approach borrows from the systems theory, and how people interact, or families, individuals and families interact within different systems, and those systems and the resources that are available in those systems. So again, it's a focus on population level and individual level determinants of health based on the systems in which patients and clients are interacting. And also understanding where that person fits in the environment. So understanding the context of the environment and how that impacts outcomes. So here, think about if someone is living in a high crime community, or a community, as I stated, with very little gyms that are food deserts, um, a community that do not have the resources available to help them reduce the spread of a virus, reduce testing um, sites in a given location. All those is understanding person and environment, and how that person is fitting in that environment, and how that environment is influencing that particular client. Sorry, I had a update. I'm not sure if that showed up on the screen. And so this link also takes you to person and environment theory. So please click on that. It gives you more detail. Both of these links give you more information on introduction to the ecological model and the person and environment theory model. Healthy People 2020, which this is now updated now to the Healthy People 2030 goals. And these are goals that are set every 10 years. And as we are now in 2020, they just recently update the Healthy People goals from 2030. You don't see any major shifts in the goals, especially as many of them are ongoing. But just to give you a sense of what some of these goals are, it's to eliminate preventable diseases, disability, injury, and premature death, um, achieve health equity, eliminate disparities, and improve the health of all groups, creating social and physical environments that promote good health for all, and promote healthy development and healthy behaviors across every stage of life, or as we like to say in social work, across the lifespan. And again, as I stated earlier, the social work grand challenges, there here are some specific ones that are directly aligned with public health. A healthy development for all youth, closing the health gap, advancing long and productive lives, and stop family violence. Again, hopefully you're really starting to understand the close tie-in between social work goals and our goals of that we have with public health. And so when we're working as social workers, we may identify specifically as medical social workers in healthcare settings, but I want you to see here that all social workers charged by our social work grand challenges, whether you're a medical social worker or you're in medical settings or not, one of the goals or challenges that we are focusing on in terms of our long-term strategic goals for social work includes the same um, areas initiatives as public health. And so, what are some of the roles then? Some of the social work public health roles include case managers, and we talked about case managers in terms of setting up key things that patients or clients may need to improve their health outcomes. Case managers help with insurances, establish insurance, or get authorization for certain insurances, help develop equipment, transfer care from one facility to the next, make sure discharge protocols are met, and that patients have the um, discharge education that they need. Health educators or program educators, where their role is to educate patients about chronic health conditions or healthy lifestyle um, choices and options. Um, Program planner and evaluator. These are social work roles that evaluate programs and their efficacy. Are they achieving the stated outcome? Are they doing what they say they're doing? Or do they need to be improved or enhanced some kind of way? So this is a more of a research component where they're really evaluating programs to see how effective they are in their stated mission or goals. Grant writers, macro, really trying to increase finances and funding to improve particularly health outcomes or to improve a program, provide finances for funding for programs to meet their stated goals and missions. Program director, again, administrative roles in terms of leadership to make sure that organizations are meeting their goals. When we think about public health and the scope of public health, it includes health and wellness, prevention, obesity, targeting areas of chronic health concerns such as obesity, smoking cessation, substance abuse and substance abuse treatment, environmental safety, and violence, particularly domestic violence, sexual assault, human trafficking also. So these are, again, areas that social workers play a role in every day in trying to improve health and safety of society and individuals and families. And what are some of the practice methods that we use to do this? Family-centered care, community-based care and services, and cultural humidity care coordination are some of the concepts that we use in social work to do this. And so public health is different or differs from clinical social work practice. And how do you understand the difference between clinical social work and public health? Public health emphasizes health promotion, broadly, protection from environmental harms, and disease prevention. It targets groups, populations, rather than individuals. That is the difference. Clinical social workers tend to be more micro. They may do in specific in education with an individual client related to areas of needs, but it's not as broad in scope and it's not dealing with not populations, programs, um, research on a grand scale, either. And so that's the difference. When you think about public health, think about larger scope, populations and groups rather than individuals, and using oftentimes statistical information to understand trends in chronic diseases and illness, and using that information and data to improve health outcomes for groups. And again, the mantra for this course: cost, access, and quality. So when we think about public health and macro level policy interventions, we're always looking at how do we keep healthcare costs down and low so that that improves the access for the care. And that's work with insurance companies and legislators, payers, and the different type of payer systems that we talked about in an earlier um, class, and really working to keep those costs low. Specifically, what we've seen with COVID-19 is a lot of insurance companies are waiving cost sharing for members, which so they're getting co-pays waived. So that improves their ability to have access to providers during a time of mental health stress and need. And again, access are the policies that you put in place to improve the ability for people to have access to health care. Obamacare is one example of this. They expanded Medicaid, and the eligibility for medical Medicaid so that more people are eligible from a income standpoint. So people who are extremely poor and people who are moderately poor now also. So before it was you had to meet a certain income threshold to be eligible, and he's expanded that income threshold so that more people meet the eligibility requirement for Medicaid, and it's Medicaid expansion through Obamacare or the Affordable Care Act. That is a macro level policy example of a macro level policy that improves access to healthcare. Other types of programs are programs that do medication assistance for people. There are a lot of programs for this for HIV positive individuals where they can go to certain health centers and programs that make that help reduce the cost of the medication. Again, that's an example of access, a program that improves access to healthcare services. And another area is quality. Um, Having incentive-based um, healthcare that does not reward providers for the quantity of patients seen, but the improvement of the healthcare outcomes. And so we talked about this earlier in the course, and you read about it in your book. This quality-based um, care models, the different ways in which healthcare systems have reorganized care. Those accountability organizations, those organizations that have continuity of care through concentrated providers, so that patients can seamlessly move through continuums and levels of care, or specialty care. Also, preventative care models, your medical homes, for example, are all initiatives to improve quality of care, particularly to vulnerable populations, vulnerable in terms of healthcare outcomes, health disparities, and income and race. And so, what are some of the public health barriers and challenges for social work? Um, no insurance or underinsured. Patients oftentimes present, or populations present with very limited or no insurance at all. Reduced number of healthcare providers oftentimes in some areas. Reduced clinical hours. And so again, all these things impact quality and access. And language, cultural accommodations. All these things serve as barriers um, to public health and health outcomes for minorities or disparities, health disparities specifically. And we also have barriers that are specifically related to social determinants, such as income, education, and housing and neighborhood resources. Again, when we're thinking about social and environmental justice, economic and social deprivation, exposure to toxin, socially inflicted trauma, targeted marketing harmful products, and inadequate and degrading care, all social and economic and environmental justice. And so community assessments. And so community assessments become very, very, very important when you're thinking about the role of social work and how it can improve public health outcomes. Community assessments are structured assessments that are your, instead of a more of your individual, they're looking at communities and assessing the needs of the community and the strengths of the community. Community assessments are done through observations of the community. What is it that you see in terms of resources, areas of needs? Do you see high crime? Do you see a lot of substance use, public health? Do you see a lot of fast food places, lack of gyms, lack of grocery stores? That's your observations in a community assessment. But community assessments also use data like the Census Bureau, public health statistics, CDC statistics, epidemiology statistics and trends, and allowing demographic statistics. So it's information telling you about cultures, racial compositions of communities, socioeconomic status of communities. To give you an idea, is this a community that is low income, moderate income communities? And using that statistics also in your community assessment. So you're using your observations, you're using your statistical data, you're consulting with databases and resources to have a better understanding or assessment of that community. And then you're even engaging in sometimes informant interviews in a community assessment. Here, what you are talking to key members in the community to help you understand the data that you're gathered through your assessment and the data that you've gathered through your statistical um, um, data collection, and then now you're getting those qualitative feedback from informants, community informants about or filling in gaps, confirming information from your assessment. And then you're doing a community analysis. Again, this is your more thorough, comprehensive breakdown of what are the resources of that community, what are the strengths of that community, what are the needs of that community. And usually also community assessments have at least some plan for intervention to address the needs. So again, it's a methods of identifying strengths and weakness in a community. It's also public authority legal mandate assessments. You know, there are some assessments that are required yearly and annually of a population, or every 5 to 10 years, such as the census, for an example. There are community member driven assessments. Again, you're oftentimes getting frequently getting the feedback from community members and informant interviews, and they define problems, gaps in service, and in a way that helps social workers advocate for improvements. And they a lot of the tools that are used for community assessments include community surveys, health impact assessments, community leader interviews, town hall meetings, environmental safety, domestic violence, sexual assault, human trafficking, awareness, education, for an example. And again, another piece key is those rich data sources to help inform your assessments. Birth, death records, health data sets, organizational statistics, Department of Health information, as well as the CDC are all rich data sources to help you with community assessments. And through this, again, social workers can make policy recommendations to improve overall health status in a given community. And so, if you be able to click on this, a model of population health initiatives reducing costs by going upstream. Example of population health initiative, you should be able to click on that to view a case study which provides an example of a population health program initiative. Please take the time to do that. So again, it will give you a good example of how population health is improved in an initiative that is set to do just that. Again, this is just a brief overview. Students are expected to read each chapter in full for more details for all the assignments here. This PowerPoint is just meant to highlight some of the main areas and to enhance and summarize your understanding of content for this week. Thank you.